So is it just allergies or is it COVID? It could be hard to tell. A new strain of coronavirus has symptoms that can look and feel like allergies. We're going to find out more, and I will tell you I am living this personally, and the test results have been wonky. Dr. Christopher Labos is a cardiologist with a degree in epidemiology. You can catch him every Sunday morning at 8:10 on Weekends with Ken here on CJAD 800. Thank you so much for your time again today, Dr. Labos.
Oh, happy to be here.
Natasha, before you even begin, I want you to ask the part that you asked me and I didn't know, which is if you get like even a faint line that you're positive for COVID, does that count? Does that mean you only have a mild case, or what does it mean? So can we ask that?
Oh, sure. I mean,
yeah.
I was going to
So I think,
go ahead.
Yeah, so here's the thing. A positive test is a positive test. While there are false negatives with the rapid tests, and we've seen that where people test negative, but then they ultimately eventually test positive for COVID, false positives are pretty rare, all things considered. And you look at the clinical context. If you have symptoms that sound like they probably are COVID, especially if there's somebody in your house who has COVID or you're exposed to somebody who has COVID, even a faintly positive line is a positive test. You should assume you have COVID. Okay. There is a sort of association that if you have a very, very faint line that doesn't turn positive right away, it's probably a more mild case because you have less antigen in your sample. But that could also just be because you didn't get a good enough sample the first time around. So you have to be a little bit careful over interpreting that. But I mean, we have seen quite a number of cases where people, when they're very sick, the line is very, very positive at the beginning, and then as they get into day 10, 11, 12, the line starts to fade and before it disappears completely. So there is some correlation with the strength of the positivity of the test, but a lot of that could also be your sample collection.
Okay, so now I'm going to bore you with the details. I was going to say, let's get an overview first before we delve into my own weird story. But
I want to know because I was confused when you asked me.
Well, I still am. So I have been suffering from brutal allergies for about 2 weeks, so much so that last Thursday, Dr. Labos, I took a test and it came back negative. I'm like, good, we're good to go to Mother's Day, visit my mom. We come back, I'm still suffering. And then my guy, Dave, starts to have the similar kind of issues that I'm having. He takes a test on Tuesday morning and it comes back positive. So just a few days later, and I mean positive, like 2 screaming red lines. I'm already out of the house. By the time I get home, I test and it comes back with the faintest line. So his has stayed strong for 3 days now. Mine was super faint. It got more faint. And now I'm testing negative without ever having had the 2 strong lines. What do you make of this?
Well, it's probably a positive test, especially when you were in close contact with somebody who was positive. So you have to look at the clinical context. So it could just be that you were testing negative at the beginning, and then the positive test results, you caught it at the tail end of the infection, and you passed it on today. That's probably the most logical or most probable scenario. But yeah, you should interpret the fact that you probably did have COVID. If you've recovered and you're testing negative now, you recovered clinically, then that probably means you were at the tail end of it and you caught it sort of right at the end.
How bizarre, though, hey, that I tested negative on the Thursday and then the Tuesday I have a faint line. Anyway, all of this to say, we were questioning whether the tests are picking up the new strains. Like maybe Dave's got a different strain and I'm having this strain that looks like allergies.
So that question has come up multiple times. The rapid tests were never validated against the different strains. You were seeing more false negatives when the Omicron variant started, with all the Omicron subvariants. But it's hard to say how much of that is a direct property of the viral strain versus collection technique, because there was some evidence that the Omicron strains were sitting further back in the throat rather than the nasal cavity with some of the earlier variants. So if you're just swabbing the nose, you may not pick up the sample, because the way the test works fundamentally, when you put the swab in your nose, you're sort of collecting fluid, which you then put onto the little test applicator kit. It requires a certain amount of viral protein there to react with the drops that you put on to turn color. If there's not enough antigen in that sample, if you didn't pick up enough of it, you will get a false negative test. So that's what probably explains a lot of the false negatives. It's, I think, unclear if there's a real definitive difference between the strains and the rapid test's ability to pick them up.
So I guess what we know here is that COVID is clearly still around and it's still mutating. So what do we need to know about this particular new strain that looks and feels like allergies?
Yeah, so the big thing that came out with this latest variant, it was causing a lot more what we commonly refer to as pink eye, so a redness in the eyes. You see that with allergies. You sometimes see it with other viral infections, and so it's not entirely surprising that this virus would also cause a redness, inflammation in the eyes, because other viruses do that too. I think the point is that it's very difficult to know what you actually have. Is it allergies? Is it COVID? Is it something else? Because there's other viruses still circulating too. I mean, that's why testing is so important, and it's why I'm a little bit sad that the pharmacies aren't offering the free COVID tests anymore, because, when it's not free, people aren't going to go and pick them up, and so it's going to become even harder for people to know what they have. To know is like whether they should treat themselves with anti-allergy medication or whether they need to, stay home and not pass COVID on to other people. So that's the real purpose of having diagnostic testing, is to know exactly what you have so that you can treat it appropriately.
So my question would then be, let's say you can't tell. I mean, ultimately what you want to do is stay home if you have COVID, but if you have allergies and you're thinking, I'm going to go to work, I'll suffer through this, as you had to do last week, and without even knowing. So the advice still, Chris, is get yourself tested as much possibly as you can just to know it's not COVID?
Yeah, essentially that. Because here's the thing. If it's allergies, there's no reason you have to suffer through it with allergies. There's actually very effective treatments for allergies. So there's no reason you should suffer with allergies in the same way that there's no reason that you should suffer with high blood pressure or with diabetes. I mean, it is a medical problem that is easily treatable. So part of the point of diagnosis in all medical fields is to rule out certain things that you know what's left and you can treat that. So, I mean, that's the point. If you are suffering from allergies, get treated for your allergies. If you're having COVID, stay home, don't infect other people, take a sick day, work from home. I mean, the technology for that now exists. So that's why it's so important. Even if you're not eligible for the treatment for COVID, even if you're not eligible for Paxlovid because you're not in one of the high-risk groups, it's still important to know that's what you have, because how you behave as a result of that test result is going to differ.
Okay. And then I'm curious, so we had COVID end of September. So we're at the 7-month point, I guess, almost, 7-month point. So we didn't get another booster when we normally would have. What are the current recommendations for boosters when it comes to COVID? Because I really like the tests. I feel like everything's just gone out the window, doctor.
Yeah, I mean, so if you've gotten COVID now, you are going to get an immune response because of it. And that immune response is probably going to last you somewhere between 4 or 6 months at least, and then start to wane thereafter. So there's no... If your last COVID infection was within the last 6 months, there's no reason to get a booster now. I think what's probably going to happen is come the fall, there's going to be an update to the COVID vaccine, so it's going to change to reflect what the circulating strains are. That is the discussion that's happening in the U.S., and the likelihood is that if that happens in the U.S., it'll likely happen here as well. So come the fall, there's likely going to be an updated COVID booster in the same way that there's going to be an updated flu vaccine to reflect the circulating flu strain. So you're likely going to see a consolidated rollout in terms of government's vaccination policy to vaccinate people against influenza and COVID come the fall, when we expect there's probably going to be a surge of cases and possibly an RSV vaccine in there as well if it gets approved by then, which it likely will.
Is that in one combined vaccine if it's a booster, or will you still take two different shots for two different things?
It's probably going to be two different shots from two different things because they're made by different companies, and there is no practical way to combine them into one injection, but they may offer them to you at the same time, which, essentially comes to the same thing.
Okay, so just before we let you go, I just want to kind of get a sense here. So if someone is suffering from allergies, A, I love what you're saying, don't suffer, get medication for it, but B, kind of work with the assumption that it could very well be COVID given this new strain?
Yeah, it certainly could be, and that's why testing is important. Again, you have to look at the clinical context. If somebody in your household has COVID and you're like, it's probably, you probably have COVID too. You may not, but again, you have to look at the whole clinical context. So even if the test result is uncertain, somebody around you has COVID, it's probably a safe bet that what's causing your symptoms now is COVID too.
Okay. Dr. Chris Labos, informative as always. Thanks so much. Appreciate it.
My pleasure. You take care.
You
too.
too.
There you go. So you feel better now knowing this, or?
Yeah, I do. I'm still confused on how I could test negative on a Thursday and how it only was, like he said, it must have been on the tail end. So maybe, but I felt okay.
And you feel fine now? And the last time you tested, you tested negative? I
tested today and I tested negative. Yesterday morning, I tested positive, but with the faint line. By the end of the day, I tested negative.
Yeah.
I just
All right.
don't trust
By
it
the
now.
way,
You know what I mean? I'm like,
to what he mentioned, those free tests are no longer free, right? We had the announcement this week by the government that unless you qualify as one of the groups, specifically, or you're immunocompromised or for very young children, you will have to pay for the test going forward. So just keep that in mind. They're
someone
no
was
longer
asking
free for everyone.
how much they are. I don't know. I would like to know that. So
Someone said they were like $9 or $8.98. But I could be wrong. That was a text that came in the other day. If you've had to buy a COVID test kit and would not mind letting us know, text us at 514-800. Tell us how much they are. We can pass that along as well.
And again, they continue to be free for those, as you mentioned, for those with complications, low incomes as well, that they are free for.
Someone also gave us a nudge, nudge, wink, wink. If you ask and you say you didn't know that you had to pay, they might give you one. But I don't want to say that's kind of how it would work. But someone suggested that's the case or that's what happened to them.